Any couple who has undergone repeated IVF failures, the main important test what they have to do is eratest or endometrial receptivity assay. It is also called personalized embryo transfer. I am Dr. Archana Ayyanathan, Medical Director of Dr. Archana IVF from Chennai. So today I am going to talk about personalized embryo transfer, or the test name is called endometrial receptivity assay. So any couple who has undergone repeated IVF failure, one of the important tests what they have to do is eratest. So in eratest, what we actually do is we prepare your endometrium by giving the same type of medicines what we give for your embryo transfer. But when the time arises, instead of doing an embryo transfer, we actually take a biopsy of the endometrium and send it for a sample which is being processed in a particular lab, where they detect the number of genes and the inflammatory modulators, everything available in that particular sample. So in this detection, they try to see whether all the inflammatory modulators and the genes which are supposed to be there in the endometrium, when a blastocyst is coming in contact with the endometrium, is there or not. So they will give us a result saying that no, it is not there, yes it is there, or yes it will come in another 12 hours or 24 hours. So the report is generally going to be pre-receptive, receptive or post-receptive. So when they say pre-receptive, it means that it is still not reached the phase of reception, that is, it is not receptive enough to take a blastocyst for implantation. So in that case, you will have to wait for another 12 or 24 hours, whatever the time is given in your report, and then if the transfer is done according to whatever the time is given in the report, then the success rates are very high. When they say receptive, it means that it is the usual 120 hours of progesterone what we have given is correct for you, and the receptivity is there, and you can go ahead with your transfer similarly what you have done in the previous cycle. And if they tell you it is post-receptive, it means that you will have to do your embryo transfer little earlier. They will give you a time, 12 hour, 24 hour, like that. So in that case, it means the receptivity has come and then it has gone away also. So generally in a natural cycle, there is something called window of implantation, which is between the 18th to the 21st day of your period cycle. So in that window of implantation, the progesterone level is very high. Actually, the concept of eratest is that the first exposure of progesterone in your body and counting the days from that time. So if you're going for a frozen embryo transfer, the first exposure of progesterone will be by giving a progesterone supplementation what your doctor gives. But if you're going for a fresh cycle, the first progesterone exposure will be from the progesterone which is secreted by your ovaries from your corpus luteum. That is the place where this ovulation has occurred. That becomes the corpus luteum. That in turn produces the progesterone. So progesterone exposure of 120 hours is what we expect for any normal individual. 120 hours of progesterone exposure is the time for blastocyst transfer. But if you have something other than 120, anything minus 120 or above 120 means that you definitely have a endometrial receptivity issue. So whoever has undergone an IVF cycle and they have experienced a failure, please do not hesitate to do this investigation of endometrial receptivity assay before going for your second transfer, because if you have this receptivity problem, how many ever times you're going to do the IVF transfer, blastocyst transfer, you're not going to succeed in it because there is a receptivity issue. It is just like the soil test what we do for the construction of a building. If it is worthy enough, the building will hold. Similarly, if the endometrium is receptive enough only, the blastocyst what we are transferring will stick to the endometrium and grow.